Hello. Today we have Dr. Satish Kamat with us. He is a surgical oncologist, cancer specialist, and practicing cancer management at Asha Cancer Hospital and Thane and suburbs for the last 20 years after an extensive training at Tata Memorial Hospital. I am Rotaract Varya Jadhav from Rotaract Club of Thane Downtown. Rotaract is a youth wing of Rotary International that works for the welfare and development of the community. Hello, doctor. So my first question to you is, how common is breast cancer?
Hello everybody. Thank you Rotaract for this initiative. Now breast cancer is a very increasing problem, especially in the urban areas. Initially it was 1 in 1,000 women. Now it is coming down to as much as 1 in 200 women. It's a multifactorial reasons for it. One of the simplest reason is late marriages, no children or less children, no breastfeeding, and unfortunately some genetic basis also. At the same time, obesity, increasing addictions, smoking and alcohol in the women is also a cause for increasing breast cancer in the urban population.
Okay, so when should a person start examining herself?
Ideally, all women should start examining the breast as soon as they develop breast. But that is very easy to say, but very difficult to manage. So what we say, if it is familial means when we do a test called as BRCA, BRCA gene. If that is positive, then the testing starts at the age of 16, 17, 18 only. Otherwise, all women in general should do what is called as breast self-examination every month. On the 5th or 6th day, there's a technique for it which can be explained some of the time, where one has to examine the whole breast, look for lumps, nipple discharge, bloody discharge, and even a lump in the axilla. Any problem out of the way, one should show the doctor early. Unfortunately, maximum breast cancers are detected in the 3rd stage and the 4th stage, even in this era where all the facilities to detect them early are available. Screening mammography, that is one test which is routinely done, but ideally it should be done only after the age of 40 or 45. Otherwise, simple breast self-examination and showing the doctor if problem is enough.
Right. So, what are the recent advancements that have been made in the cancer treatment?
Basically, there are 3-pronged technology initially: surgery, radiation, and chemotherapy. In surgery, we have better diagnostic technology where we do small needle biopsies and we go for breast conserving. Nowadays, only 10% breasts are removed, nearly 90% of the breasts are preserved, because of which post-operatively family life and the patient's psychology is better. In radiology, definitely very early stages, T1 tumor, that's called a less than 1.5 centimeter, elderly person or even young women, if there are no spread, we can do what is called as a short radiation directly to the breast. That's called as a brachytherapy. And good advances in radiation have reduced the side effects of burning of the skin, hardness of the breast tissue. So nowadays we don't realize that the patient has been radiated. And there has been phenomenal increase in management of chemotherapy and hormonal therapy for breast cancer, which has risen to extended survival of more than 25 years. So that is the one cancer where we are very successful. And now latest addition or armamentarium is immunotherapy. That has also come into our armamentarium, so that are also increasing survival in advanced breast cancer, metastatic cancers. The other things which naturally we should follow is a proper diet, exercise, keeping weight under control, and regular self-examination. This all combination increase the survival and longevity of the patient.
Right. So, are there any potential side effects with regard to the treatment?
Definitely each and every treatment has its side effects. First and foremost, surgery and radiation. We have to remove what is called as nodes from the side. So because of which patients develop swelling of the hand, that is called as a lymphedema. So this is where after the operation we have to do simple exercises like this. You have to exercise routinely so that the hand stiffness is not there, there is no frozen shoulder, and the edema comes down. If the hand doesn't move, simple exercise like climbing up the wall, simple PT exercises, washing your back, that's the simple ways where you can do and the limb mobility can increase. Then other advances now are we do what is called as sentinel node biopsy. Initially we used to remove all the nodes, now we remove only 1 or 2 or 3 nodes and see if they are positive. If they are negative, treatment is over from surgery point of view. So that reduces the risk of lymphedema. And now one more advance has come where we do lymph node vascularized transplants. These are very skilled procedures where a node from the other areas is shifted here. So after removing all this, the new pathway is created so that there is no edema. Because lymphedema is a very severe problem for women, especially now. You imagine patient is going to survive for 20-25 years. So one hand is only 12 inches, the other will be 25, 26, 27 inches. So it's not easy to carry that arm around. So these advances are very important. Secondly, radiation, we try to avoid giving radiation in the axilla and the node. So the side effects go down. Chemotherapy advances, unfortunately medicines have come up very well, but side effects are the same. Women lose the hair. This is where self-care by the women is very important. Self-care means whenever you are awake, take care of yourself as if you don't have cancer. Don't forget applying your mascara, don't forget doing your eyebrows. And when you lose the hair, either you can buy a beautiful wig or you can tie bandhanas and make yourself presentable. Because the first thing anyone sees when they get up is your own face. And if your face is good, the whole day goes fine. So one should look presentable, one should not be depressed and be presentable to self and the society. That upbrings the spirit and the fighting morale. There are many other changes which occur, blackening of the nails, blackening of the tongue, and cracks in the hand and the foot. So for all that, most important is self-care. Apply proper body lotion liberally. Don't be stingy about it. Take adequate nutrition, especially liquids. Women unfortunately reduce their water intake because we don't have good toilets on the public toilets on the way. So women don't like to go to the toilet. So the water intake is less. And as soon as the water intake is less, body gets dehydrated, toxins increase. Our chemotherapy also causes vomiting, more dehydration, more side effects. The simple option is hydrating yourself internally and externally with body lotion. That is, will maintain your milieu and keep you healthy. So water intake is very important. One can have veg, non-veg food, that is not a problem. But avoid red meat. Once person gets cancer, we tell them to avoid red meat. They can have egg, fish and chicken, but avoid mutton and rest of the things. One other side, small thing which happens in our Indian women is they eat what is called as शीड़ा खाना. जो रात को बच्चा रहता है वो अगले दिन वो लेडी खाती है, हस्बैंड और ये नहीं खाते. ये बंद करो. Everyone has to share it or prepare only that much so that your food gets over in the night. Don't keep it for next day. So शीड़ा food should be avoided. Another important, there should be no complete bed rest. Patient should rest but not bed rest. They should do their regular activity. They should walk. They should exercise. Keep themselves fit. Avoid putting on weight. Weight is the biggest enemy for breast cancer. The more the obesity, more the estrogen progesterone imbalance, more the chances of cancer and side effects of cancer and its treatment. As the weight increases, dose also increases. So again, it's a vicious cycle. The simplest option is keeping yourself fit and reducing your weight to the ideal as per your standards.
Okay, so as you talked about self care and looking at the emotional part of the disease, do you have a program to psychologically support your patients?
Definitely. There are two ways of psychologically supporting it. One, we have trained doctor psychologists who are in called and patients are avoided, then they give the time. Unfortunately, a little bit of finance is involved here, and somehow women or Indians don't feel like giving money to talk. So they would want to pay if you get medicines, but just to talk to the person and getting counseling, they are hesitant to pay. So we have support groups. We have formed patients groups who are called, they come and counsel the women. These are women who have just recovered from all the treatment they have taken, maybe 6 months to 20 years. They are self-trained and they come and talk to the patient and alleviate the fear and answer some questions. The most important, however, is the treating doctor. Ask your question to the treating doctor. The simple thing is keep a book, write down your questions. Because once you lose the chamber, you suddenly have new questions. So write it down and ask them when you come. Avoid Google searching a lot. A little bit Google searching is important, there's no doubt, because the simplest symptom, Dr. Google. And then first diagnosis is cancer, 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 fear, raising fear in everyone's mind. The simple things, you can search Google for elevation of your problems and follow them after advice with your doctor. A support group is very important, which is has to increase more in these areas.
Right, but I think the support groups might be limited because of the pandemic. So how has the pandemic affected the cancer treatment?
Pandemic has unfortunately affected a lot. I'll be very frank, initially we used to say there were two big C's which were affecting our health. One was cancer, the other was cardiac problems. These were the two big C's which were there, and now this is the third big C, COVID. Hopefully, COVID should come under control in the next few months and we should go back to normal. In the last 2 years, women have stayed at home, they have not come out of fear, they have not shown the doctor. Even we doctors were unsure how aggressive to treat because we were not sure COVID was how the women will get cancer with COVID, how to manage. These were a lot of grey areas which are slowly now resolving. Unfortunately, definitely last 3 months onwards, since the lockdown has reduced a bit, we have got patients who had symptoms for the last 2 years sitting at home and now coming in third stage and all. That is really sad about it. There are women who have stopped treatment because they thought they could not come. The most important thing was lack of transport. People just could not come. It is not just Thane. We get patients from all over the country, all the suburbs and all. So there was no traveling. They could not travel to our place, and so they stopped the treatment and the disease has come back in a more aggressive way. So that is definitely the side effect of pandemic. And third is, unfortunately, financial capacity is also reduced. People have been at home, they have lost jobs, so the earnings have reduced. So women, and they neglect their health. That is the last priority. The first priority is roti, kapda, makan, and then comes the health. So all these combined reasons, the disease has come back in a big way. We are more struggling to control them. These women would have been cured 2 years ago. Today we are trying our best. Let's hope that we succeed. In fact, today only, one of my women, I gave a stamp of all clear. She's finished 10 years. She's off all medicines. It was such a joy to see the face, a smile on her face. So I was very happy. And she also came after 2 years. That is very important. Because of COVID, she was not coming. Luckily, she was continuing the treatment. That was the one good part. She was continuing the treatment, and today only I gave her the system that she is cancer free.
Great. So the willpower and the positive thinking plays a huge part in the treatment as well. But some women might not take it positively, and that might affect her body image issues or might bring some other, mentally, what do you say? Sorry.
So definitely, I agree with you. Mental, social problems are there, especially body image for self. In the days where we were removing the breast, it was open up and then one side flat, the other side big, was a big issue. And especially the husband, that was an issue which would crop up. Luckily, with breast conserving, that issue has reduced. But this is where counseling both the partners is important, where husband is also equally supportive. That is where it is important. So it is not just physical act, but the mental ability with which they are two bound together, that matters. In this, I'll tell you a small thing. When I was abroad, patients used to be alone and they knew everything about them, and relatives did not know anything. Relatives had to take appointment and come to see the patient. They could not just drop in any time. So they used to come with the whole family, big bouquet and video games, chocolates, everything. And everyone used to say, good, hang in there, man, you are going to do well. Hang in, baby, you are going to be fine. That's it, hug and go, finish. And she would be alone to look after herself. What happens in India? All the relatives know, the patient doesn't know. She doesn't know what she is undergoing. She can't ask anyone. If you ask, no, I have taken decision, finish. No one asks the lady, do you want chemo? Do you want hormone? Her opinion is the last. First, all the husband, the family, extended family, they come. Then all come uninvited. Especially in COVID, it was really sad. We were very strict, no relatives. But still, neighbors, friend. And the first thing after seeing everything, Arey, you good, huh? My neighbor passed away with this disease 5 days ago. So this negativity starts spreading fast. And then the self-doubt comes. So positive energy is a must. Two women, one relatively positive, the other with negative attitude, taking the same treatment, we have found that positive person definitely benefits more. And this is where alternative therapy in the form of yoga, pranayama, meditation, belief in your God, whichever God you believe in, helps out. This is where self-discipline and belief in yourself and your partners and your friends. And I am a little old-fashioned, but the most important is to trust your doctor. Don't have misconception. Trust your doctor. If you don't trust this doctor, change your doctor. But then trust that doctor. Whomsoever you're taking with your treatment with, please, ते म्हणतात ना, सोपून द्या त्यांच्याकडे, and whatever he or she does, they will always do for your best and follow their advice properly. It is that way.
Right. So, do you have any general suggestions that you could give to your patients?
First and foremost, before becoming patient, become breast self-examination. All your friends and everyone should know what is your normal breast. You cannot compare A breast with B breast, C breast with D breast. Each and every girl is different. So each person should know her own body image. Any changes, don't be shy. Biggest important thing is shyness. Show the doctor at the earliest. The disadvantage of cancer is the lump or the problems appear to be very small initially. It's a painless lump. So many times there pain nahi ho raha hai, chhod do. Pain nahi ho raha hai, chhod do. So, and luckily, a painless lump mein 90% are benign. Benign means no cancer. Of that remaining 10, different diagnoses are there. But still, one should show the doctor at the earliest. Second, have a self-discipline that I told you. avoid junk food excessive intake. Once in a while is okay, but a regular diet of junk food is not good for anyone. 3. Have moderate exercise. You must walk at least 6,000 steps per day. If you can, you have apps on your mobile or even the watch you can have and monitor it. 6,000 to 10,000 steps every day to keep yourself fit. That is more important. Weight as per the height, roughly it is height minus 100 in centimeters. That should be the weight, 5 kgs up and down. And be happy. And water intake. Please drink 2 to 2.5 liters of water every day. And avoid addictions.
Great. Thank you so much. This was a wonderful session. Thank you so much for joining us.
Thank you, everybody. Stay healthy, fight cancer, be happy, know your own body. Take care. Bye.